All right. Welcome, everyone, to the next webinar of the McLean Hospital Crafting Support Project 2026 Family Webinar Series. I'm Dr. Julie McCarthy, and I'm a clinical psychologist and researcher at McLean Hospital. Tonight, I am very excited to have you with us for a panelist presentation on navigating mental health resources for families with Maggie Tyler, Krissa Rouse, Jill Gichuhi, and Lisa Charland. And before we begin, I'll go over a few reminders. Folks are welcome to change their names if you want for privacy for making any questions or comments in the chat anonymous. And you're welcome to enter any questions that you would like in the Q&A or chat, and I'll keep a closer eye on both this time. And we'll address questions in the latter half of the presentation today. And we ask that you do engage and use the polls and chat for any audience participation as appropriate if you like, and to share any additional resources that might be helpful for us all to know about. We are recording the presentation and Q&A discussion, and when recordings are available, we'll let folks know. All of our past ones up to this past month in June have already been uploaded to YouTube. And to continue to improve the webinar series, we encourage you to complete a brief anonymous and certainly voluntary feedback survey to share your thoughts, preferences, and ideas for future webinars. So this can really help us and our whole community to continue to improve the quality of information that we share with all of you. And it may be shared anonymously in the future with other researchers or folks who are interested in trying to rally additional support for expanding family services. So I'm going to put that in the chat in just a sec so that anyone can reach that feedback link if you need it. Okay, so to get started, we'll talk about what the Crafting Support Project is for anyone who might be new. And welcome to everyone who has already been here. And also to get a better sense of who is here, I also wanted to put out one of our polls to kind of see who's in the audience tonight. Let me see if we can get that going. All right, so if you don't mind, you are welcome to share what best describes your role. Family member, person with lived experience with mental health challenges, clinician, none of the above, or multiple identities or roles. So feel free to take a moment to check in about that if you like. And someone puts in the chat, parent. Thank you, thank you. And we'll close the chat or the poll in 3, 2, 1. And it looks like we have got 88% of our audience tonight are family members, and we've got some folks with lived experience with mental health challenges, clinicians, and then folks who may fall into other categories as well. So everyone is very welcome to be here. Thanks for coming. Okay, and so what this is the Crafting Support Project, family services. And part of this really had come from many of you, perhaps before this existed, or maybe even before some of the resources existed that we'll be talking about today, may have at some point or another been looking for support on how to help a loved one, or maybe how to help ourselves too, and not always knowing what to do, what was the right thing to say, what was the right and most helpful support to give. And so we really wanted to put together accessible and sustainable resources that could really help answer some of those questions and get the latest and greatest information out there to the public. So we were very fortunate to get philanthropy donations to support this work. And one arm of this is our family webinars, which we're all here for tonight. And we're about halfway through this year's lineup, and we have had some wonderful speakers so far. We have some great speakers coming up as well, so feel free to stick around for any of those that you're interested in. And if you'd like to see the past recordings, feel free to take out your phone, check out the QR code, or go to the Crafting Support Project page on YouTube. And the other arm of the services that we have is one-on-one coaching, or right now we've actually adapted this for an insurance-based service. So this is open to Massachusetts families. I understand we have folks from all over, and we offer usually on average 8 to 10, but up to 12 weekly one-on-one sessions with a coach or therapist like myself. This is on Zoom. Typically, we could potentially meet in person as well, depending on the scenario. And we have just hit our 1-year anniversary this month, which is very exciting. And it's been a very popular service. So I really foresee this continuing into the future. And if folks are interested, you're welcome to contact me at jmccarthy@mclean.harvard.edu. And we do accept insurance. And so if you have questions about that, feel free to get in touch. Okay, so before I introduce our fantastic panelists today, the second poll and last poll that I'm going to share tonight will be about how familiar you are with some of these resources that we'll be fortunate to hear about. So if you wouldn't mind checking off which ones of the listed resources here you have heard about, received services from, have participated in, maybe have provided services through. This would be the Cole Resource Center, Schizophrenia and Psychosis Action Alliance, the McLean Hospital Pearl Program, and Compass Helpline at NAMI, Massachusetts. That would be wonderful to let us know if you've heard of these before. We'll close the poll in 3, 2, 1. Okay, and so some folks in the chat are sharing may not be familiar with any of them. Some might be familiar with some, but not others. And so it looks like the most folks are familiar with the Compass Helpline at NAMI right now, then Schizophrenia and Psychosis Action Alliance, followed by the Cole Resource Center, and then the McLean Hospital Pearl Program, which makes sense because it is the newest of the bunch. So there are those results if you wanted to take a quick look. All right. And so without further ado, I am going to introduce our panelists, and then we're going to hear from each one of them. And we'll be hearing from Lisa Charland, who is a peer specialist at McLean Hospital, where she facilitates groups and offers one-on-one support to people in the schizophrenia and bipolar disorder program. She also speaks for the National Alliance on Mental Illness, NAMI, in our own voice program, sharing her story at businesses, hospitals, schools, and support groups, and more. And Gichuhi is the program manager of the Compass Helpline at NAMI, Massachusetts, where she leads a dedicated team of Compass navigators. And before coming to NAMI, Mass in 2016, Jill worked for more than 10 years in information and referral and peer and family support roles. So a wealth of knowledge there. We have Krissa Rouse with us, who is the Director of Programs and Community Engagement at the Schizophrenia and Psychosis Action Alliance. And she's dedicated her career to supporting individuals and family members in recovery after the initial episode of psychosis. She also has years of clinical and research experience working on Maryland Early Intervention Program and Early Psychosis Intervention Network projects, and working on a first episode team at the University of Maryland School of Medicine and the Maryland Psychiatric Research Center's first episode clinic. Last but not least, we have Maggie Tyler, who currently serves as the Resources Director for the Cole Resource Center. So she is a dedicated mental health advocate and family navigator, guiding families and their loved ones through the complex journey from mental illness to recovery. She provides patients and their families with resources such as legal aid, SSDI support, ongoing therapy, housing, and workforce development, which I'm sure you'll hear a bunch more about, utilizing her expertise and lived experience. She's also a mental health first aid facilitator with me at McLean. So I'm going to stop sharing my screens, and let's see. Lisa, would you mind sharing about the Pearl program first?
Yeah, Julie, thank you. Thank you for the introduction. So yeah, we recently started the Pearl program. We do have a family group associated with it, which I'll tell you more about. But we also have a lot of groups for adults that, are available to people regardless of diagnoses. Some of them are social groups. We have a psychoeducational group called the Wellness Recovery Action Plan. And the social groups kind of include like tea and conversation, craft and create, book club, gaming group, etc. So those are mostly drop-in groups. And the family group is also a drop-in group, but I'll tell you about that in more detail. So this is a family group that is that focuses on schizophrenia, bipolar, schizoaffective, and psychosis. And like Julie mentioned, I'm a peer specialist at McLean. I'm also a family peer. So I actually have two brothers who have bipolar disorder, and I have bipolar disorder as well. And we're all in recovery. And so like I've seen like, what I've gone through, what they've gone through, and can bring that experience to our group. So we meet, it's an in-person group, and we meet each Thursday from 6 to 7:30 p.m. in the admissions building at McLean. Right after this, I'm going right across the hall to see them. So, um, and yeah, like I said, the group is drop-in. So it's open to any family member who has a loved one with like the mentioned conditions, and we have it open to family members only. We have several parents, but we also have partners, siblings, and children. So anybody can benefit. And the reason why we keep this so specific is because we've had some folks who go to various family groups, and sometimes they get a lot out of them. They're wonderful, but it's hard to relate if you have a loved one experiencing mania and psychosis versus like depression and anxiety. Like it's such like it's a very unique experience. And so our family members tend to like really relate to each other, like having those experiences. So that's kind of why we keep it specific. So the group topics, we do check-ins each week. It's like, how is your loved one doing? We talk about signs and symptoms, stigma against the individual and against family members, whether or not to disclose the condition, um, dealing with police and their mental health resources. Some police departments have a social worker on staff, or like some kind of resource where a person can like go on to a list, of people that like, okay, this person has a mental health condition. So if you find them or like, run into them, just know that they have this condition. We talk about like medication side effects, caregiver stress and burnout. Have to emphasize that it's so important to take care of yourself while you're taking care of somebody else. And I know it's really hard to do that. Staying connected, even if the relationship is strained, setting boundaries when needed. And we also just talk about everyday things that might be uplifting. Like, we definitely don't shy away from the difficulties of, what's happening, but we also try to like keep it light in some ways. And we also like focus on hope. So we do group speakers about once a month. We had Joanne Grady Savard from Peer and Family Support Services at McLean. Like she visited us and gave us a ton of resources. Rhonda Bourne from our AB2 inpatient unit at McLean visited and did a sort of like ask the social worker session. And we have Samantha Stein, another social worker, who's going to be visiting us this month. And Steve Fideli, who's a peer specialist and coordinator of the Well Space program here at McLean, is going to join us to share his recovery story in August. And I just have to say, we have a great group of folks right now. And some of them are watching, so hello. Um, but and they've got to know each other very well, and they're so supportive of each other. They're supportive of each other, like in the group and even like outside of the group. And I really love that. It just like so happened to be this way that like our group tends to like have sort of a sense of humor. So like I said, like we talk about light things and we talk about difficult things too, but like it's just like I've had people say when they leave the group that they felt lighter because like we were able to like joke about something, or just the support that they got. So yeah, so feel free to join us if you're interested. We'd love to have you. And we're also thinking about if there is a demand, having like a Zoom group online. I just haven't had much of a demand of that yet, but it seems like something that some people are interested in. So just like email me and let me know, and I will put my group flyer in the chat. And so you can see my email and everything. So that's me.
Great. Thank you so much. And excellent idea to put that information in the chat. Okay, Jill, would you like to go next?
Yeah. Hi, everybody. Hopefully you can hear me. So my name is Jill Gichuhi, and I am the manager of the Compass Helpline at NAMI, Massachusetts. If you're not familiar with NAMI, it stands for the National Alliance on Mental Illness. It's kind of a nationwide network of organizations that are connected together. We are a program of the state chapter here in Massachusetts. We cover all of Massachusetts. If you're calling in or you're joining us from another state and you want to find NAMI in your state and you don't know how, you're so welcome to reach out to us. The first thing we'll do is help you find NAMI in your state and where you are. But as I mentioned, I manage the Compass Helpline, and we're the helpline at NAMI, Massachusetts. We answer questions about the mental health system and related systems of care. I think other folks, as other folks have noted, that's everything from like housing to health insurance to public benefits to sometimes like other basic needs like food resources or transportation. It's peer and family support. It's actually finding mental health treatment, and it's kind of everything in between. Sometimes it kind of like moves outside of mental health altogether, and there's things like autism or traumatic brain injury or things like that. And our goal is to get people to the next best step. Sometimes that's something here at NAMI. Sometimes that's something that we offer. We do free support groups across Massachusetts for both people with mental health conditions and family members and friends. Sometimes that's resources outside of what we offer. So at some point in time, I have referred people to all of our colleagues here today. And honestly, most of the time it's things outside of NAMI, Massachusetts. But we're free. Anybody is welcome to reach out to us. We take phone calls, we take emails, we take schedule calls, we take actual postal mail. If you send me postal mail, like you'll be my best friend and will reply with stickers. I love postal mail. So hint, hint. But anybody is free to reach out to us. We typically now we do not take live calls. We do take scheduled calls or calls by voicemail. We're not a crisis line. I think that's a really good thing to know about us. But again, we do our best to get people to the next best step. I see in the chat that someone asked what our hours are. We are open from 10 a.m. to 6 p.m. I am the helpline right now. I know Julie said, well, like probably because I said we have a nice team. I am the team right now. So honestly, like we're open 10 a.m. to 6 p.m. I will probably be sending emails at 4 a.m. to people, or at least writing them. I probably won't send them at 4, but I'll be writing them then. So, it's good to be patient with us and not expect an immediate reply. We're just not staffed for that. But again, like anybody is welcome to reach out to us, and we try to get people to the next best step. And I will say, I meant to start with this, but I will say, like, I'm a person with a mental health diagnosis myself. I'm also the mom of a 24-year-old who has his own like challenges. And so at some point between myself and my son, we've navigated most systems. We've navigated health insurance. We've navigated school systems. We've navigated being inpatient. For him and for me, we've navigated public benefits. We've dealt a lot with like mass health, Medicare, and everything in between. So one thing that we offer is like a lived experience perspective. Like if the system you're running into is like honestly like not very responsive, is kind of shitty, like we've probably experienced that too, and that's part of what we do is try to acknowledge realities of the system. So that's all I'll say for now. But thank you for having me here, Julie. I love talking about our work.
Great. We love listening about it. So thank you so much, Jill. All right. So next up, we have Krissa. Would you like to take it away?
Absolutely. Thank you to the Crafting Support Project for inviting me to this very important conversation. I know that many families, for many families that we work with, that I work with in Maryland, that we work with at SMPAA, the first signs of psychosis absolutely do not arrive with a clear roadmap or a manual, right? And that often this this journey is so full of worry and confusion and sleepless nights and difficult conversations and painful questions, and wondering if your loved one is still within reach. And families often, of course, find themselves trying to understand what is happening. And so at SMPAA, I am lucky to be the resource here that I'm here to share is SMPAA, Schizophrenia and Psychosis Action Alliance, and I'm lucky enough to be able to help lead in programming alongside a program manager with lived experience of psychosis and a resource line coordinator who brings lived experience as a caregiver, and I'm a clinician. So as a trio, we run the programs and the resources. So we have a clinician, a caregiver, and a person with lived expertise of psychosis. And so our governance leadership is also including several professionals and with lived experience of psychosis and lived experience as caregivers. And what that means is that the family perspective is always present in the resources that we offer and how we make decisions and set our priorities at SMPAA. We also lean really heavily into the guidance of our peer advisory council and our family advisory council. And we have recently begun to develop more of a crossover through a PFAC leadership program because we believe that matters, that family members and peers often see different parts of the same system. And bringing those perspectives together helps us build resources that are more honest, and more practical, and really responsive to what people actually need. And so a deeper dive into what SMPAA offers, I did put in the chat. I put it a little too early. I didn't know it was going to post, but there's a flyer coming up in the chat now as a PDF that talks about all of the resources that SMPAA offer to families and caregivers, but also to your loved ones. Because so some of the resources are actually for your loved ones, because I know working with families, many families, they want just us to help their loved one, right? That's what's going to help you, is to help your loved one. But along the way, you need support too. And so we have the resource line, and similar to what Jill was saying, we do not have a crisis line, but we have a resource line. It is not answered live either, but our coordinators will get back to you within 24 to 48 hours. Families can call or email and ask for personalized resources. We have lovely individuals giving encouragement and helping you find next steps. It's especially useful for caregivers when you're unsure where to begin, right? Like, many people call and they don't know what they need. So they say, tell me what I need, right? And so we have plenty of resources to get folks started and have you looking at our toolkits and things of that nature. And then we welcome you to circle back and tell us what it is when you're figuring out what you do need. Once we give you some preliminary resources, we ask you to circle back and let us know how we can fine tune those resources for you. So we love working with folks on the resource line. And as I said, we have someone with lived experience as a caregiver answering many of the calls, or someone with lived experience of psychosis answering many of the calls. So walking that walk, knowing what the journey is like, and being able to guide you. A couple of other exciting things that we're doing is, of course, we have caregiver support groups on Hey Peers. They're called Schizophrenia and Psychosis Caregivers Better Together. And so we are training about 3 or 4 times a year. We're training a cohort of new facilitators, and we have a co-facilitation model. So we try not to ever cancel groups. We always have 2 leaders, and so it's you can register for a whole series of groups. So on Hey Peers, you can just get registered, and like one and done, you're registered for the series. You show up when you can. If our groups are full, there is a wait list that you can join, and the group leaders, because many folks will join for a series and then not actually be able to show up for the group. So if you're on the wait list, it's important to know that you show up for the group. You get an email about 10 minutes before the group starts, and the leaders can let you in, because generally once the group starts, it's not actually full, but it's full to capacity for registrations. So that's just really important for folks to know, is that if you're looking at a group and you want to come, sign up, show up, and you'll get into the group. You move into a standby room, and then the leaders can let you into the group. So if you want support and it looks like it's full, have no fear. We also have we're excited. Many of you have probably heard of Cures, Cures Z, Bethany Yeiser's foundation. And so Cures and SMPAA are collaborating now to grow Cures Friends Mentor Program. And so we're excited to partner with Cures. We're called the Schizophrenia and Psychosis Action Alliance. We don't want to do anything by ourselves. So we love to partner with other organizations and see how we can fill gaps together for the needs of our community. So we are partnering with Cures, as I said, and we're helping to grow their mentor program so that anytime a caregiver raises their hand and says they need a mentor, there will be a mentor available for them. So in the fall of this year, in just a couple of months, Cures will be having an informational session. We're training a bunch of mentors, and then we'll be looking for mentees to match them with. And often folks can match with a mentee in person. If we can usually find one in your area, and you can have sort of a mentorship in person. But if we can't find one in person, it can be virtual, and folks do really well. And SMPAA would really love to expand that program to become a peer mentor program as well. And so we're excited about the potential there. We also have education for individuals and caregivers, and mostly in the fashion of toolkits and a few webinars on our website. And so in that handout, you can link to a couple. We have a couple of toolkits. We have a caregiver toolkit. Many of our caregivers love our I'm diagnosed, now what toolkit. It's actually meant for individuals, but it's very helpful and informative for caregivers as well. And so caregivers often download that one and share it with their loved ones when their loved one is ready, or when their loved one is ready to receive that. We have a new family and caregiver webpage coming in probably next month, where we'll house all of the resources that we have, and we'll be growing the resources for caregivers and family members. As I mentioned, we have a peer and family advisory council that we work very closely with to build our tools and resources, and build the infrastructure for our resource line and so forth. We do a lot of advocacy and awareness for those of you who are ready to kind of raise your hand and say, I want to change things. This wasn't a fun journey for me, and I want it to be different for others. And we have a HIPAA toolkit that is coming soon that will include template letters for when you're navigating any kind of HIPAA boundary, HIPAA barriers in helping your loved one navigate their care. I think I will maybe leave it there and let us move on, and we can talk more later in the discussion section.
Sounds good. I think everyone is very excited to dive into those resources, and we will email them to folks after the webinar. All right, Maggie, would you like to share about the Cole Resource Center?
Yes, and thank you for inviting me. So I am part of the leadership team at the Cole Resource Center. I am the director of resource navigation and women's family support groups. And we've actually been around for 35 years. And we used to be located on the campus of McLean Hospital up until about a year and a half ago, where we sort of broke away. But we support families who are caring for a loved one with a mental health challenge, but we also support those who have sort of bravely journeyed through treatment and are now ready to get back to work. So we have 3 programs, and we do them in these few key ways. So first, we provide resource navigation. I mean, much like the women here have detailed. The mental health system is complicated, it's overwhelming. So families come to us, not knowing where to start. And I think I've heard that from this group. They don't know where to start. They don't know what to do next. So we sort of help them understand what their options are. We connect them with search tools for finding providers, and then we kind of help them make a plan. We do not replace clinicians. I just want to make that clear. None of us are clinicians. I feel like we do sort of wraparound work for McLean Hospital and other places like that, but we are not clinicians. But we just try to walk alongside families so they just don't have to figure this out alone. So that's our resource navigation. And then we have our women's support group. So These groups are for women who are caring for a loved one with a mental health challenge. We feel that these groups are really powerful spaces. We're not about fixing anything. We're just about letting them know that they're seen and they're heard. So we run these women's support groups twice a week, Saturday morning at 10 a.m., Tuesday mornings at 11 a.m. Each group is facilitated by two trained facilitators. And I've had women in the group. Some come twice a week, some come once a week, some come once a month, some come once a year, but they do keep coming back. So then our third program is our workforce program, which I'm really proud of. So this program supports individuals who are living with mental health challenges, but have gone through treatment to the point where they can either enter or re-enter the workforce. Because recovery isn't just about symptom management, it's really about, building a life, it's about purpose, it's about autonomy, and it's about dignity. So we help participants develop practical skills, build confidence, and really take meaningful steps towards employment. And we are now piloting a new program, which is called Bridge Forward. And so this is for young people that have maybe done a semester or a year at college, but they had to take some time out for treatment to get well. So the Bridge Forward program is for those kids that are not sure. Maybe going back to school isn't the right thing. You know, we try to figure out that bridge between having to have left college, which my daughter had to do sophomore year, and what the next step is. So we're piloting that now, and so far it's been great. So that's me.
Wonderful. Thank you so much, and congrats on the new pilot program.
Thank
All
you.
right, so now we will open up the floor to Q&A. So feel free, any audience members, you're welcome to put your questions in the chat if you haven't done so already. And to kick us off, with all of these great resources, you know, I'm wondering, since there's such a range of services that each of your individual resources or organizations offer, what type of support are family members looking for the most, when they come seeking assistance, if there is, one that stands out? Yeah, Jill, go ahead.
I will say, I think like Krissa, you kind of alluded to this. We have a lot of families who reach out to us and they're looking to kind of like fix their loved one, solve the problem of their loved one. And here in Massachusetts, for those who are here in Massachusetts, like the law is it's very skewed towards patients. It's very skewed towards people getting to make choices in their own life and their own healthcare. And I'm personally very pro that. I'm also my son's guardian, and I know that like sometimes, you kind of have to take the reins in a loved one's life, and or you feel like you have to, particularly if they're young and they're kind of putting themselves into dangerous situations. And it's like a tightrope like that I personally walk. But I think that a lot of people reach out to us about what we refer to as the impossible question. How do I get a loved one to do what they don't want to do? It's the number one thing people reach out to us about. And like the
Fair
answer
enough.
to that is often like family support. Like
Mhm.
taking care of yourself.
Mm. Yeah,
And
definitely.
I would say that we try to break that down with a scalpel.
Yeah.
I mean, because we all want our loved one to get well,
Yeah.
but it's not linear. So, what steps do we have to go through to get there? So we try to speak to everybody that comes to us because, I think Jill, people come to us, they think they know what they want, but after talking to them, you realize actually that's not that's not what you want. Let me try to help you understand, what your next step is.
Or what they think will be helpful is probably not going to be the
Yeah,
conclusion they
it's
think it is.
never helpful.
Krissa or Lisa, any thoughts for you?
I'll say what's sadly what's coming to mind is the things that we don't have that people are still
Oh,
like
interesting.
wanting, right? We get a lot of calls about housing, and we do have a housing toolkit that's on our handout, but it's as effective as we can have it be because housing is it's so vast and different in every space and county and state and so forth. So housing, and then we are also working on to build a justice center for serious mental illness because
Oh, wow.
so many of our calls are about a loved one who needs treatment, having intersected with the justice system. And so we are working toward building a justice center for serious mental illness and schizophrenia to have resources readily available and legal advice and sort of things like that. So sadly, what's coming to my mind is what we recognize is there's a gap in resources that
Yeah.
we're at SMPAA trying hard to fill. And another thing that I love helping individuals and families with is like I think Jill, you mentioned that if folks they want their loved one to take everything that they want them to have. And so I like to work with individuals and family members, mostly family members, to help them take care of themselves while they patiently wait and subtly help their loved one come to a point in their recovery where they're ready for some of the same kind of help that maybe their family member. And so I love to tell family members, maybe model taking good care of yourself and you will be well, and your loved one will see you being well and doing these things for yourself. So come to our support groups, use our resources, take good care of yourself, be patient with your loved one, and invite them and can keep inviting them to do some of the things that they see you doing, and sometimes just model that behavior and eventually and be patient. You can't force your loved one, but you can't force your loved one to take care of themselves, but you can take care of yourself so that when they decide that they would also like to participate in that kind of recovery, you'll be well enough to enjoy it with them and help them to come. I also have a private practice and I work strictly with families. So I'll see the individual living with psychosis, but I also want to see their family. And so I tell some of my parents sometimes that you need to work through your trauma too, right? It's traumatic, helping a loved one after a first episode of psychosis specifically. And so I say, work on the trauma that you have been through. And sometimes my clients are getting more well than their loved ones are. And I say, you don't want your loved one to surpass you in wellness, right? Like keep up with them. So really, I think that we don't promote that enough, like, and give enough resources for how to take care of yourself while know that your loved one will come along eventually. We hope that will happen. So
We have a little mantra, try not to work harder than them. And that's hard, but it kind of sets up some guardrails.
And I know we have some more questions in the chat first. So Lisa, anything that sticks out to you in terms of what you feel like folks are most excited to get, from the RAP group that you had mentioned, or the family group, I'm sorry, that you had mentioned?
Yeah, I think like some of the themes that come up in my family group is, we do like general check-ins and such, but we also like focus on psychoeducation sometimes. Like the group in particular is interested in cannabis and psychosis and like how, bad it is for psychosis. How do I talk to my loved one? Especially if they are unwilling to get treatment or try medication. And so I often refer them to you, Julie, for your crafting one-on-one sessions. And several of them have gone to that, and they've learned a lot. We've talked about like motivational interviewing, and as people have brought up financial planning and what will happen with their loved ones if they pass away, et cetera.
Yeah.
So those are like some things that like come up a lot. And I think like, you know, in regards to my other groups, a lot of people are looking to socially connect. That's a big one. For the Wellness Recovery Action Plan, that's more of a
Hmm.
psychoeducational group. So
Hmm.
people are trying to like grow in their recovery and like recognize like, okay, when, um, you know, when do I know if like things are going downhill or like things are getting bad again? What can I do to help prevent a crisis in the future? What are my early warning
Hmm.
signs? What are my triggers and stressors? And then if something does happen again, you know, they have a crisis plan that their loved one can follow. So for instance, like my husband, he knows like what I want done if it happens that I'm in a state where like I can't really take care of myself. And so I have that plan for him, you know, and he knows like what hospital to take me to and you know, what I would like done. So yeah, those are some really exciting things about that group too.
Yeah, thank you for sharing. Actually, one quick question that someone put in the chat was, is the Pearl program something that has been or could be replicated elsewhere?
Maybe you know, we're so new.
Sounds like people are interested, so maybe that's
So
food for thought for the
yeah,
future. Okay.
definitely
Um,
email me. Yeah.
there were a couple of questions about the scope of the programs that you all are talking about. Certainly in person, you know, for the Pearl program, yes, that's for folks in Massachusetts or folks willing to drive to Massachusetts, perhaps. For the other resources, um, could you all just briefly reiterate, you know, how you might be able to help people who are anywhere in the country or the world, perhaps?
Yeah, I actually do have one online Zoom group that is
Oh,
open
wonderful.
discussion for people who experience the condition. So we meet from 5:15 to 6 p.m. on Wednesdays. And it's called the Community Support and Resources Group. So we do like check-ins or we have open discussion or
Nice.
people can get like resources. So yeah, I can get a flyer in the chat about that as well. So anybody can join. Well, anybody with like a mental health condition can join that. So like if you have loved ones, then they can join.
Great group support. Thank you.
Yeah.
I'll share that our resources are available anywhere in the world. And so
Nice.
all of our support groups are on Hey Peers, which is a virtual
Mhm.
platform. So you can join our support groups from anywhere. Our toolkits are downloadable from our website. We have some exciting new groups starting. We have a group for individuals of for in the care for the caregiver's perspective. I think it's interesting. We have a group ready to they're training, the facilitators are training now, but they are the daughters of parents with schizophrenia. And so
Mm.
they're young caregivers. And so we're
Mm.
starting a group for children of parents with living with serious mental illness with psychosis.
Nice.
We're also starting a gaming. I heard, I think it was Lisa say you have a gaming group,
Mhm.
and we're starting a virtual gaming group. And
Oh,
interestingly, we're working with a group of individuals with lived expertise, and they asked if we could open it up to family members because they'd like to invite their family members
that's
to,
a cool
you know,
idea.
siblings or parents who want to game as well.
Mm.
So for caregivers who are looking for something social to do with your loved one or to get a little more knowledge about like their gaming interests,
Yeah.
we're going to be launching that probably next month with a couple of young guys that are gamers that with lived experience with psychosis, and so we're thrilled to be able to invite family members to that. And one in per so I think and we just trained a couple of support group facilitators. One was in Beijing and
Wow.
one was in Ireland. And so not that that matters because you can join virtually, but even our facilitators are
Mm.
coming, you know, from all over the country and all over the world. So I think pretty much, but for those of you who want something in person, we are moving finally back to a model of training individuals to run in-person groups
Mm.
that fell by the wayside before the pandemic, like but at the
Right.
pandemic. So we're finally getting to a place where we're going to go back to some in-person groups around the country as well. So if anybody's
Mhm.
interested in learning how to run one of those and wants to run one in their community, feel
Mm.
free to reach out. We're always having ongoing trainings for in-person groups as well as virtual.
Yeah. Fabulous. Thank you.
I just wanted to add, like, we're in Massachusetts, so we're definitely most helpful to people who are also in Massachusetts. But NAMI is across the US,
Mhm.
and so you can reach out to us to find NAMI where you are. You can look on the NAMI.org, NAMI National website to find the NAMI where you are. And why this matters, support is kind of universal. Virtual support groups are great. Most other systems are not universal. Krissa
Mm.
kind of implied this for housing, definitely not a universal system. Health insurance, finding a provider, even not a universal thing. And so finding people who are local to you, who understand the systems near you, is something I would definitely recommend. We
Mhm.
do get calls from people out of state hoping that we can help them find resources where they are, and we
Mm.
really can't, because states are so different. I have a good friend who's in Connecticut. Even in Connecticut, it's right across the border. It's so different.
Yeah.
It's,
Yeah, I agree
it's
with
just
Jill
so
because
different.
I
Good point.
totally agree. So our women in our women's support group come from all over the country,
Mm.
Canada, because they can join the group and it's fairly universal. But when people are actually looking for resources, like Jill said, every state is different. So we used to think that we could handle the country. Well, we can't. So we think we can kind of do New England, but even that's tough. I
Mm.
mean, as, as far as providing resources, like Jill said, we really try to focus on Massachusetts, and that's kind of enough for us.
Fair enough. Okay, thank you so much. So let's see. I think some of the questions that are coming in are kind of talking about some of the challenges that families are going through with their loved ones, often folks who might be in their 20s or 30s. And, I think one of the comments that doesn't necessarily have like a specific question, but I think maybe that's because it's not always clear, where to turn. Any advice on what you think could be helpful for families who are in a situation where maybe their loved one does have a serious mental health challenge of some sort or another, is not engaged in treatment, probably could benefit either from treatment or peer support or, someone else. But point is, the family member in this situation might feel like they don't have the bandwidth to, fully provide all of that care or kind of, you know, figure out all of the job and the housing and health insurance, especially if this is someone who's an adult and everyone's, not getting younger. So I guess any thoughts on how to start to move the needle on making some of those gradual changes that a few of you have alluded to, that might take some time?
I will say I'm in my 40s. I have a 24-year-old. I've
Yeah.
also been a 20-year-old with mental health symptoms, including
Mhm.
psychosis. And I've been in that place where, like, I didn't want to talk to people about it. I especially did not want to talk to my mom about it. I still
Mhm.
don't talk to my mom about it. I didn't want to hear what other people had to say. And I
Yeah.
kind of had to find my own way to there.
Yeah.
I was a young mom. I got married at 19 and I had a child at 20. So I was pretty young, and like kind of life caught up with me. And there is some truth to, you kind of just have to let the bad happen to people.
Mm.
If I'm a parent and I'm talking to other parents, I talk about ways that you can support your loved one that isn't focusing on the mental health. So like with my son, he lives in a group home. It's great. I get to be mom, but I don't have to be his day-to-day caregiver. And we talk about cleaning and we talk about music, and his middle name is Paul Pierce from the Celtics. We talk about the Celtics. We talk about like anything but mental health, because if we talk about mental health, that will be really upsetting to him. And so I want to maintain that relationship. So I can't force them, even as his guardian, I can't force them into treatment.
Of
There's only
course.
so much you can do.
Yeah.
So I work on maintaining the relationship. I work
Mhm.
on like what things does he allow? What, as his mom, I like to go to the group home and clean. He's okay with that, so I do that. As
Mhm.
his mom, he does not want to talk about mental health. Even as a guardian, he doesn't want to talk about mental health. So we
Yeah.
don't. And like that's what I would have liked when I was young.
Mhm.
I ended up like cutting people out of my life who insisted on these things for me that I did not want for myself.
Mhm.
And I am always really cautious that when we're talking to families that they're kind of leading their loved one down that path, that they're
Mhm.
leading that loved one down the path to where that loved one is going to cut them off. And
Mhm.
you know, all they have to do is like stop trying to push it, let it
Yeah.
happen naturally.
Yeah. Okay, thank you. And Krissa, I see your hand up as well.
Yeah, one of the things that I do a lot with the families with whom I work in Maryland, after a first episode, but we treat longer sometimes, so many years into recovery. But I expand recovery oriented cognitive therapy to the family work that I do, and I say, think about what your loved one wants in this world, in this life. And I'm not talking about goals per se, I'm talking about aspirations. What does this person really want? And look for those moments when they're at their best, right? Because even if your loved one is struggling with a serious mental health condition or psychosis or any number of substance abuse, they still have moments when they're at their best. And you as a caregiver, you know how to recognize those moments. And so when you see your loved one at their best, they're feeling capable of something. They're feeling maybe not like a sick person, right? And those are the little windows where parents often say, I didn't want to ruin a good day by bringing anything up, right? But guess what? Those are the moments when your loved one can often hear you and believe that what you're saying is possible, right? So
Mhm.
I teach family members, and even I use recovery oriented cognitive therapy with individuals as well. And we're looking for aspirations such as, for many people, it's to help others, right? And so your loved one may say, well, I would like to be a surgeon, or any number of things where they feel like they're being helpful. And it may seem like they need to take years to get better and go to school and get a job in order to do whatever it is that they want to do. But they can help people today, right? And so if it's not the goal that we're necessarily concerned about, it's like, what would that goal give you? How would that change your life? So if you can connect with your loved one on aspirations and get them out doing like living their aspirations right immediately, it really starts to, I think, wake them up to the fact that they are capable, they matter in this world. They start to develop reciprocal relationships where they are needed. And so they feel much better and capable of doing other things, like maybe working, maybe getting into treatment, maybe hearing what you have to say about how you notice that when they were on medication, they were doing a lot of different things, and since they've stopped their monthly injection, they know you notice that maybe they're not doing so much, and like, let's think about this.
Mhm.
So just looking for those moments where your loved one may be at their best. Don't always shy away. You're not going to ruin the moment necessarily if you approach it, with just kind of positivity. And I'm noticing also telling your loved one what you see in them and what you enjoy. If you spend time together, tell them what you enjoyed about it. Tell
Mhm.
them how much you liked seeing them laugh, right? And like, what was so great about that for you? Because I just loved seeing you laugh, and I haven't seen that for
Mhm.
a really long time. And I love to tell my clients, like, hey, let's find your funny again, right? Like, I know you're funny. I've
Yep.
seen it. Let's see if we can find it again, and let's start testing it out at home. So I think some of
That's
those
a great
things are
idea.
encouraging for folks. And you don't really need any resources. This is just kind of about knowing your loved one and looking for small
Mhm.
windows of kind of making baby steps in the right
Yeah,
direction.
thank you. Also, quick question for you, Krissa. To confirm, the support groups are free through your organization. Is that correct?
Yes, and you
Yeah.
know what? I
Okay.
might not have said this,
Thank
but
you.
they're all free and they're all peer led. So they're
Hmm.
all peer groups. So our they're all caregiver. I don't go, I'm a clinician, I'm not a caregiver.
Right.
I don't go to the groups because they're peer led, they're for caregivers,
Hmm.
and our peer groups are for peers, and they're led by individuals living with psychosis.
Great.
But
Thank you.
because I didn't mention this, that which is probably the most important point. All the services at Cole Resource Center
Right.
are also free of charge, and so I have a team of five for the women's support group, five women facilitators, and we're all mothers dealing with a loved one with a mental health challenge. So we're all trained facilitators. And then our workforce program is peer led. So our three leaders of the workforce program are also peers. I mean, I think that's important to just bring that up. And
Mhm.
my resource navigators are all peers in that we're caring for a loved one. So I don't know,
Thank
there's
you.
something important about knowing that we're on the same journey.
Of course. That's one of the reasons why I was, so excited to bring all these resources together. I know we have more questions than we can get to today. Perhaps a quick one. Any quick thoughts on um, a resource or someone at one of your organizations that could help with how to support a loved one who's interested in tapering medications? I mean, those side effects are no joke, I get it. And also they can be really helpful medications. And also, like any treatment, it doesn't work for 100% of people
Yeah,
necessarily.
even when you're gonna like change your medication, you
Yeah.
you taper it.
Yep. Sure.
I like to say to people like I take ibuprofen every day. It's very over the counter. We can all take it. If I was gonna stop, it would be smart to taper it because my body
Hmm.
gets used to it.
Good point.
Off of the top of my head, I can't think of the names of them, but if you reach out to me, like we have a couple of solid resources.
Mm.
Including peer support groups, including peer-led, like more intense programs, including things that you can read that are all focused on tapering, or
Mhm.
thinking about tapering psychiatric medication. Some of them are specific to antipsychotic medication. Some of them are like
Mhm.
more global towards psychiatric medication in general. Some of them are helpful for like medical, like non-psychiatric medication.
Right.
So again, not off the top of my head, but there's a few places that we typically send people to when that question comes up, and it comes up fairly regularly for us.
Okay, that makes sense. Thank you. So another question that we could have one person answer, perhaps. Folks are often aware if they're an adult of a young adult or other adult who is navigating mental health recovery that we may need to do some long-term planning to set people up for success. So even knowing that, it can be hard to get started. So any advice or thoughts about what could be helpful for a caregiver to kind of mentally prepare for, you know, putting some of those longer term supports in place, whether that be financial, housing, care continuity, or otherwise?
I'll say just real quickly, finding a mentor who maybe has done some of that work
Mm,
for themselves and their family.
yeah.
And in the family support groups that I do run some family support groups
Mhm.
in Maryland for the clinic
Mhm.
with whom I work. And we talk a lot about whatever you're doing, maybe do it for more than one person in your family. Not maybe like long-term planning and financially, but if you're
Mhm.
doing an advanced directive for mental health, do one for the whole family. Like, don't
Mm,
single your loved one out and say you're the only one that needs this because you're the sick
mhm.
person.
Sure.
Normalize it, right?
Yeah,
Normalize it and say, hey, you
that's
know
a good
what?
point.
If you're an adult but you're not married, and you don't have a spouse, then we just need to
Mhm.
make sure that someone is able to speak for you if ever you're in an
Yes.
accident or you're and do a medical advance directive and
Mhm.
a mental health advance directive and sit the whole family down and normalize it and say we all need to think about what would happen to any
Mhm.
one of us if the other weren't here, if one of us isn't here.
Right.
And so I'd say I advise folks to get a mentor who's maybe been through it before, and you can do that through Cures. They have mentors of all spaces in the journey of recovery, and
Awesome.
also normalize it. Like do some planning with the whole family.
Sounds good. Thank you. I'm going to ask two just yes or no questions for the sake of time. For the gaming group, are these like online gaming groups where they can game together live? Yes or no?
Mine will be, yes.
Yes.
For SMPAA,
Okay,
it will be.
great.
But I think,
Perfect.
was it
Thank you.
Jill or Lisa? You have one in person, right?
It's in person,
Great.
correct.
And
Yep.
then are the resources aside from NAMI available for folks with borderline personality disorder? Because I know we've been talking a lot about psychosis. So the answer is yes, this could be applicable for all types of
Yeah, I mean, I would say
experiences.
in my group of women, my women's support group, I would say borderline personality disorder is at the top.
Yes. Mhm.
Yeah.
Can definitely be common. And then also, I will refer folks to perhaps follow up with workforce development at Cole Resource Center or any of our wonderful resources to navigate how to balance getting disability and wanting to work and how you can best do that. It sounds like all of you have perhaps more knowledge on that particular front than I do. And then
I received SSDI for 10 years and
yeah.
went back to work and worked my way off of Social Security. It definitely can be done, and Social Security definitely
Yeah.
encourages you to do it and has lots of support in place. So
Thank
if
you for
that's
that
your loved one, definitely you can reach out
encouragement.
to us or my colleagues here.
That's wonderful to hear too. So we're going to have to wrap up the Q&A and we'll just zoom through our closing remarks. So thank you everyone for coming. We've got some additional McLean family support groups here. We've got our feedback survey that I will put in the chat again. If you have other ideas or questions that you still want answered, if there are enough in a certain area, we'll maybe create a whole webinar about it. And then also just wanted to thank everyone who has made the research, the clinical work, and everything that has led up to our webinar tonight and continues our work going forward. And next time, Thursday, August 13th from 5 to 6 p.m., we have Javier Amador presenting on the LEAP approach and anosognosia. So if you've ever heard of the book, I'm Not Sick, I Don't Need Help, Dr. Amador is the author of that book, so feel free to come and check that out. And if you want to get in touch with me, my information is here. And thank you so much. And I hope you all have a great rest of the night. Thank you, everyone, for your amazing insights.
Thanks, everyone.